Now, the shutdown was supposed to buy the government time to build up capacity to keep Canadians healthy and safe. But here we are at the end of April, and the government still hasn't produced a single new ventilator. Federal shipments of masks and test kits have been defective or contaminated. Health Canada still has no plan to fast-track new drugs or testing. In fact, we recently learned that more than 50 companies are still waiting for approval to distribute test kits. Experts have said that Canada needs to triple its daily testing before loosening restrictions. So where's the plan to do that? They stuck, as you know. Just yesterday, we learned that the Liberals cut the number of stockpile storage locations for critical medical supplies by 1/3 in the past 2 years, and Canadians want to know why. Certain provinces have been able to flatten the curve and are now starting to talk about when they may be able to slowly start revising health restrictions over the coming weeks and months. This has raised concerns about a possible patchwork approach across the country. Other countries have released national frameworks, so why hasn't Canada? Does the federal government have a plan to start revising health restrictions in an orderly fashion when this crisis passes? What are the eventual benchmarks that will guide lifting border and travel restrictions? Do we have enough personal protective equipment? How much PPE will be required to support key industries? How is the federal government preparing to get ahead of a possible second or third wave? Canadians are looking for clarity and leadership during this crisis, not more confusion and delays. It is incumbent upon the Prime Minister to present Canadians with a plan immediately. From the beginning of this crisis, this Liberal government has been slow to react, slow to close our borders, slow to put in place enhanced screening measures in our airports, slow to admit that masks could prevent the spread of the disease, slow to procure much-needed medical supplies, slow to increase the wage subsidy, devastatingly slow to offer help to our energy sector. Today, we proposed a new program to match students and youth employees with jobs in the agriculture and agri-food sector, including fish and seafood, to address labor shortages in Canada's food supply chains. We've also called for more support for seniors and raised concerns with reports that expectant mothers who applied for EI before March 15th are not receiving the Canada Emergency Response Benefit they are entitled to. Well, we're continuing to ask the tough questions about the day-to-day operations of the government and their slowness and inability to get many of these benefits out the door and to ramp up things like testing and to fast-track approvals. We have several times called for a permanent Auditor General to be named to ensure that there is a very rigorous process of transparency and accountability. I believe that when we're through the health phase of this crisis, there are going to be an awful lot of questions as to why the government did or failed to do many things, including like dumping significant percentages of our stockpile, closing down warehousing sites, and of course, ensuring that accountability happens is key. And that's another thing that we will be pushing for when Parliament does resume is a very comprehensive look at what happened.